Okay, so first I'm just gonna go wash my hands or put hand sanitizer on, one or the other. And then I'm going to grab some gloves. And today we are going to be doing a piggyback with Mr. Smith's primary that's going right now. And then we are also going to be doing an IV push. So first I'm just going to get my IV push stuff ready. And first I would check the MAR though. So we have morphine, 4 milligrams, which this is 4 milligrams as well, every 2 hours PRN for pain. And then I'm just going to do my medication check on my piggyback, vancomycin, 1 gram, and they match. I would also make sure that there's no floaters and that this solution is clear, and make sure there's no tears or leaks in the bag or any bubbles of any sort. And I would do the same with checking this medication. I would make sure it's not foggy or anything like that and it's clear. Okay. Now I'm just going to clean the top for 30 seconds. And then since it's 4 milligrams per 1 ml, I would drop 1 ml of air. Now that I drawn up my 1 ml, I will recap. I'll recap it. And then throw my needle away. And then I just want to make sure there's no air bubbles. And I'm just going to put this back into the container, and that's ready to go. And then before leaving the medication room, I would just check my prescription again against the MAR, and I would label this morphine 4 milligrams per 1 ml. And then check this against the MAR, make sure it's the right patient and that it's appropriate to give it at this time. And then I would check the vancomycin again, 1 gram, and make sure it's for the right patient and at the right time. So I'm just going to collect my things and go to the patient's room. I would knock before entering and then introduce myself to the patient, saying, hey, my name is Cheyenne, I'll be your nurse today. Can I get your name and date of birth? And they would give me that information back. And then I would just educate them on what's going on. I would let them know that we're gonna be starting their piggyback at this time, and then also giving them pain medication due to their pain from earlier. Okay. So first I'm just going to check the MAR again against my morphine before I administer it. Make sure that it's 1 ml per 4 milligrams, which it is. And make sure this is the right patient. And I would also ask him if he has any allergies and to make sure that he's not allergic to this. And then after that, I would assess the IV site to make sure it's not infiltrated or no redding. It's not redding. It's not red, and there's no edema on the site as well. So first I'm just going to get my flush ready. And then I'm going to clean the insertion site for 30 seconds. And then I would just flush 3 to 5 ml just to make sure that the IV site is still patent. And I would do this slowly. Okay. Now that I know that it's patent, I can go ahead and administer the morphine. And this morphine, I would, per policy, that's the rate I would administer. In this case, it would be 5 minutes, but for the sake of the video and time, I will be administering quicker than 5 minutes. But that's how long I would administer it. Okay, now that that's administered, I'm just going to flush again, just to make sure that he has received all that medication and that it's out of the line. And I would do 3 to 5 mLs. And before doing an IV push, I would have stopped his primary infusion from running. And then since I'm going to be doing a piggyback, I'm not going to start the primary right now at this moment. Okay. I'm just going to check and make sure I have the correct tubing for this piggyback, which would be secondary medication set. And then before I hang this, I will just do another check against the MAR to make sure it's the correct medication along with the correct dosage and for the correct patient. And then I can ask the patient again for his name and date of birth, but he had already given to me before we administered the morphine. So, and I would also ask about allergies. And since this is a pump, it doesn't matter the level of the primary, but if we were running on a gravity feeding, I would have the primary lower than the piggyback. Okay, now I'm just going to, my drip chamber, I'm just gonna fill it up halfway. Okay. And now I'm just going to prime my tubing. And I want to make sure there's no air bubbles in the tubing. And when priming, you want to make sure you don't lose any medication if you can, but if you do, you want it very minimal. So since that is primed, I'm just going to hang that up here. And I'm just going to clean the insertion site for this piggyback. And I'll clean this for 30 seconds. And I would open the clamp. I would set my rate that corresponds with my MAR, and then I would open the clamp, and then I would let my medications run to the patient. Okay, that's it.